Dear viewers, this is Khushi welcoming you on Mera Doctor Show. And in today's topic, we're going to talk about common cold and flu. Colds are certainly the most commonly occurring illness among human beings. The common cold, including chest cold and head cold and seasonal flu, are all caused by viruses. You may use over-the-counter medications to relieve the symptoms of cold, including sore throat, runny nose, congestion and cough. While flu symptoms are similar, it includes fever, muscle soreness and headache. In this case, see a doctor who may prescribe antiviral medications to you. What are the causes for your common cold? Several different hundreds of viruses may cause your cold symptoms. Rhinoviruses are the type that cause most colds, but they can also be caused by coronavirus, parainfluenza, and many others. Because colds are caused by so many different viruses, there likely will never be a cure. We cannot develop immunity to cold because there's always a different kind of virus that our bodies haven't seen which cause similar kind of symptoms. What are a few things that do not cause cold? Wet hair, cold weather, and changes in the temperature. These old wives' tales have been shared and passed down for generations, but it has no basis in science. Research has shown that people may be more likely to catch cold during winters when the air is dry and cold. But it is not the weather which makes you sick. It is only the germs which can do this. What are the symptoms of common cold and flu? When you wake up sneezing, coughing, feverish, and that achy, can't move feeling, how do you differentiate whether you have common cold or flu symptoms? It is very important to know the difference between a common cold and the flu symptoms. A cold is a milder respiratory illness than the flu. While a common cold symptoms can make you feel bad for few days, a flu can make you feel sick and ill for few days to weeks. The flu can result in serious health problems such as pneumonia and hospitalizations. What are cold symptoms? Usually cold symptoms begin with sore throat, which usually goes away after a day or two. Nasal symptoms, congestion and runny nose follow along with the cough by 4th or 5th days. Fever is uncommon in adults, but a slight fever is possible. Children are more likely to have fever with a cold. With cold symptoms, the nose teems with watery nasal secretion for the first few days. Later on, these becomes thicker and darker. A dark mucus is natural and does not always mean that you've developed a bacterial infection such as sinus infections. How long does the cold last? Cold lasts for about a week to 10 days. During the first 3 days, you are very contagious. It means you are going to pass the cold symptoms to others around you. So, stay home and get some rest, which is much needed. If cold symptoms do not seem to be improving after a week, it means that you might have developed a bacterial infection, which means you might need antibacterial medications. Sometimes you may mistake a common cold for allergic rhinitis or hay fever or even a sinus infection. If cold symptoms begin quickly and improve after a week, it means it is a common cold and not an allergy. If your cold symptoms do not get better after a week, then consult a doctor to see if you have developed a sinusitis or an allergy.